Today I'm going to talk about a very important subject. It's called keto diet. And let me begin from here by telling that the purpose of my video is not to discourage people from following a healthy lifestyle, a healthy diet to have a good, figure, to have a good, weight and height proportion and all those things. That's the thing that you should achieve, have a good figure, good lifestyle and a healthy body. So that's my educational direction that I'm going with today. So the problem is that when should you not do keto? So it's the fact that not everybody is the best candidate to do a keto diet. That's my point that I want to elaborate here today. So let's say you want to lose weight fast, but why should you not choose keto? Okay, so number one thing that I found out in my research is keto is something that makes you prone to get kidney problems, specifically kidney stones. And if you have some pre-existing kidney problems, let's say chronic kidney disease or anything in that regard, you should not do keto diet. Talk to your doctor first. That is a very important thing. Do not take your own steps. Do not take your own initiatives, okay? Secondly, let's say you have diabetes. Diabetics are already prone, especially type 1 diabetics who are taking insulin, or even type 2 diabetics who have to take insulin. They could be really, really prone to get ketoacidosis. So you are already getting, in that direction of having ketones in your body. So be very, very careful. Talk to your doctor before you proceed with a keto diet in that regard as well. Another important thing in keto diet is you are prone to get something called keto flu. So what is a keto flu? When you cut down your carbs to minimum like 0 or something like that, and you want to finish your tummy fat, finish the fat all over the body, and you are trying your best, all of a sudden something happens to you, like you start having nausea, you start having dizziness, you start having constipation, you have no bowel movements, and you are dehydrated, your blood pressure drops down, and you fall down and you end up in the ER. So that's something called keto flu. So be careful about that kind of scenario, and if you see yourself getting in that direction, please talk to your doctor right then and there, because you might not be the best candidate to try that out, because this kind of scenario, the keto flu kind of situation, can last for weeks, and it can ruin your career or exams or whatever, or even your job, or something could be really critical. Let's say you are a truck driver and you are trying to do the keto diet. I do not want you to have dizziness and end up having a very big road traffic accident. Or even if you're a mother and taking your kids to your school, I do not want somebody to end up hitting somewhere and having a big accident or big problem, and then you're in a big problem, because once you get into the ketoacidotic coma, in that case it gets really hard. And I have literally seen patients and treated patients who got ketoacidosis, and then it was really hard to bring them back from that kind of state of being in a coma state and problems where they are like drowsy and dizzy for a long duration, because sometimes that can last for weeks, and you might have an extended stay in the hospital and ICU and lots of other scenarios we have seen happening in the ER and ICU setup and the hospital setup. So be very careful. Talk to your doctor, have a nutritionist before you take that kind of steps. Another important problem with keto is you end up having GI issues, your gut issues, because your gut gets dry. You have digestive issues, and you end up having constipation because you're not getting enough carbs, you're not getting enough, vitamins and minerals and all those things that you would get otherwise, and you are so dry. you are dry like a, dry as a bone, so be very, very diligent about that kind of things, and be very careful, because you do not want to put your immunity at at a task, at a place where it's gonna make you susceptible to infectious diseases, including COVID and a lot of other problems. So be very, very careful. And another thing is, if you are on a keto diet, you are prone to get nutritional deficiencies, because you are limiting yourself to one specific diet plan, and that leads to nutritional deficiencies, and then you end up having something big, like you have weak bones because you are losing all those minerals in your diet. You are not getting calcium, so you get osteoporosis because no calcium, no vitamin D, no magnesium, and a lot of vitamins you are missing from your diet. So be very, very careful. I do not want you to end up having bone mineral deficiency. And research and all the publications that you can check in my description, they have proven that these people who do keto for extended periods, they end up having weak bones. If you do the x-rays of these people, they have very fragile bones, so you are prone to get fractures, easy fractures. And if you already have osteoporosis or weak bones and cavitations in your teeth and so on and so forth, then you should be extra diligent before you begin keto diet, because you can have a lot of big problems. Let's say if you are an osteoporotic patient, or who has really weak bones and teeth and so on and so forth, and you are doing keto for an extended duration of time without any discussion with your doctor and a nutritionist, you can have some really, really serious fractures of your hip fracture or spine fracture, and they would be so easy to fracture that you would be surprised that, oh my god, I did nothing and why did I get a fracture? But at that time, things would be really much deteriorated and it might be too late. So be very careful. That's my sincere concern for all of my audience here. And please convey to others as well. And they did a study on 130,000 people, and in another study they also studied 150,000 people, and they found out that people who are doing animal based diets for the keto, instead of plant based diet, they ended up having more heart diseases, more cancers. So it's better if you do plant based keto diet instead of animal based keto diet. I'm just giving it to you in a nutshell. So but for details, check out my description and you can come across those publications that I went over before I explain it here. Another thing is, be very, very careful about your overall health. If you have any chronic illness, you should not start taking keto diet, so be very careful about those things, and talk to your doctor before you begin all those things. Thank you so much. Have a great day. Bye.